Hi everyone, I'm Dr. Ildiko Csiki, Chief Commercial R&D Officer for City of Hope, and I'm here with Dr. Harlan Levine, President of Strategy and Business Ventures at City of Hope. He's also the chairman of the board of AccessHope, City of Hope's wholly owned subsidiary, focused on serving the employer market and making leading-edge cancer care available to all, regardless of geographical locations. Thank you so much, Harlan, for agreeing to this, participating in this discussion. And let's get started by telling us a little bit about what is AccessHope.
Well, hi, LD, and thanks for having me here today. You did a nice job of describing it. It is a subsidiary and it is targeted towards the employer market, but also for serving their members. Employers are recognizing that oncology care is becoming much more expensive, and yet the quality of care and the outcomes is highly variable, as is the cost. So on one hand, you have good news, which is genomic medicine and emerging targeted therapies are leading to significant outcomes for cancer patients. But on the other side, the rapidity of the progress has resulted in increasing complexity. And that's what's leading to the variability. In fact, one could argue that oncology is one of the few areas of medicine where the gap between what is now optimal care and what is actually happening or typical care is widening. And I think reflective of that is the fact that 4 out of 5 medical oncologists will self-report that they don't feel completely confident in their ability to keep up with the rapidity of all the changes in genomic medicine. So AccessHope products are specifically designed to close that knowledge gap and support both the person with cancer and the provider so everyone can benefit from the latest science while the patient remains in their home community.
That's great. Can you tell me a little bit more about how does it work?
So sure, from a business point of view, AccessHope is engaged by the employer directly for the most part, and it has 3 products. The first product and its signature product is called Accountable Precision Oncology, and it's actually a unique product in the marketplace. And what it does is it proactively identifies employer member patients with cancer early. It does that by partnering with the TPA, which is the third-party administrator, or the health plan, or the pharmacy benefit management company. And it uses algorithms to identify people who might have cancer early in their journey. As part of the process, experts review the case, and the experts are always a subspecialist in that type of cancer, and that's the key to success in the program. And then as a team, as a member of a faculty, as you know, cancer is multifactorial and often requires radiation oncologists and surgeons to weigh in. We create a comprehensive consultation. And then again, another element of the secret sauce of the program is we directly communicate with the treating doctor. It's like giving the treating doctor a little private tumor board in their ear to help support them. And we can support them in the diagnostic workup, in the interpretation of genomic testing, or in the treatment decision process. Another important thing we do is because doctors are getting so busy in the community, we can help identify available clinical trials that might be appropriate for their patient. So that's the main product. The other 2 products, the second one is a cancer support line, which is a team of nurses that are oncology trained that are available to the member with cancer, and in fact, even their family members, to call up and ask about any question that may be on their mind. This helps them with their cancer journey. The questions can vary from how do I live with cancer to how do I prepare for a doctor visit. We get some patients that even call up and say, I'm about to get chemotherapy, or I'm about to get radiation therapy, and I don't know what that means. Will I be glowing after the treatment? So we're able to really help people on a very personal level manage through the journey, which is, with cancer is an unwanted journey. We make this very broad. A person can call up about if any family member. It doesn't have to be a person covered by the employer, because we know that when anyone in the family has cancer, it's really quite a burden and can be quite distracting. So we're there to help with the journey. And then the third product is like the first product in that it's a expert opinion with a specialist and a team. It's longitudinal in that we support the course of treatment over a period of time. But in this case, it's the member that has the opportunity to opt in and say, raise their hand and say, I want to have a second opinion. That first product I talked about, the accountable precision oncology, is a proactive outreach that we make based on algorithms identifying the most complex cases.
Can you tell me why did City of Hope establish this terrific program?
I think the first and foremost reason for doing it is that it's supportive of our mission at City of Hope to serve more people and address the healthcare disparities that exist across our country. By focusing on the employer, we're focusing on a really important segment of the healthcare continuum. In fact, one that shares a lot of values with City of Hope. While we all care about affordability and the price of care, the employer, like City of Hope, also cares about the outcome, the quality of care, and the patient experience. And this gives us an opportunity to directly help more people with cancer from that broad point of view. We also see that this is going to be a growing need over time, and we're going to continue to need to disseminate this information. In fact, we like to say we're democratizing access to good scientific knowledge, because as the discoveries in cancer keep coming, and that's what this conference is about at LA MedTech, we're going to see more and more need for this sort of information to be shared across the country.
Yes, absolutely. And this is such an innovative program. What has been the market response so far?
Yeah, it's actually been spectacular. We've only been in existence a little bit over 2 years, and already we have 42 large employers that we work with that are our partners. This covers about 2.2 million members. And in fact, we are also working now with a health plan and working with a third-party administrator. And in fact, we now have a formal relationship with a very, very large employer consortium as well. The other impact we're seeing in the market is that even employers that aren't partnering with us are now asking their health plans and their health management organizations to up their game. So it's really great to see all the changes that are happening in oncology these days.
Yes, it's creating a ripple effect in itself. And how, can you tell me a little bit, how are physicians responding when they receive a call from an AccessHope doctor?
Yeah, you're really asking the key question that all of our customers ask us and the health plans ask us as well. We had concerns going in. What would be the reaction? It was one of the first things that we tested. We did a lot of patient testing, but we also talked to physicians in the community. And to be candid, the response has exceeded our expectations. And now we're trying to figure out why we were so concerned about it in the first place. I think it's working out well, in part because of the culture of AccessHope and the way that the doctors approach the physicians. These are partnership discussions. These are not mother may I discussions. We're not there to talk about utilization management or even trying to fit people into a guideline where it doesn't really apply. The cases that we call about, and particularly in accountable precision oncology, these are really hard cases. And a physician taking care of these patients is usually either doing a lot of work on their own to go through the literature and find out what's the best thing for the patient, or they're referring out to an academic institution for a second opinion. And in that case, they're always worried that the patient's going to go into witness protection program and never get seen again. Or they're going to bed at night worrying that they're not really doing everything they can for the patient. So by making these calls, doing it in a collaborative way, we're actually improving the user experience, if you will, or the workflow of the physician. So they've been incredibly well received. And I think evidence of that is the fact that while I would say the median or the typical experience is 1 to 2 calls with a physician, we have several cases where the physician will call us back 5, 6, 7 times and discuss a case as the patient evolves over time. So I think by designing the program to understand the needs of the community physician, we've ended up having great uptake. And in fact, we even get emails and phone calls thanking us for their help.
Thank you. How do you measure the impact that the program has created? And perhaps you can share some stories where it has been really impactful for patient care.
Well, so I think the way you ask the question is the right way to ask it, because we start with the patient stories, and those are the ones that tell us that we're having impact. Um, so we get uh, stories from patients that, in fact, there was a case where someone had a very complicated sarcoma, and the recommendation was to do a bone marrow transplant, which was within guidelines and a reasonable thing to consider. But when we looked at the case, we saw the genomic profile of the sarcoma, and it was very rare. And we were able to identify that of the 8 people that were documented in the literature that had that genomic defect or mutation who received bone marrow transplant, they all died within the first year. So we were able to talk to the treating physician about the data and actually change the course of that patient's treatment from a bone marrow transplant that was highly likely to fail to targeted therapy that gave the patient much better opportunity. What was really interesting about that was the physician, I believe the first person they spoke to was the bone marrow transplant doctor, because that was the initial request. And before the doctor was convinced, they wanted to speak to our sarcoma expert also. So that was a very powerful case. But we also, on the nurse line side, we get very personal interactions with patients, and we help people manage who are taking care of 2 or 3 children at home and how to manage through chemotherapy, or we can often answer their questions. When a doctor's recommending a clinical trial, there's that moment that you're just taking in all the information. You can't ask questions of the doctor in that moment, but when you get home, you think about it, and they want to know, are they a guinea pig? And we're able to really alleviate stress by explaining what the treatments are like, and why their doctor may have recommended something. And probably one of the biggest stress reducers is to actually help the patient prepare for the next doctor visit by arming them with the right questions to ask. So those are the we'd call some of the softer benefits, that stories that raise the spirits of everyone who works at AccessHope. We do have hardcore measurements. We measure how many times we made recommendations that either change the diagnosis or change the treatment. We also look at some of the more humanistic things, where we may be making recommendations that help with pain management or psychosocial issues. So in general, we will have impact on a case on more than 4 out of 5 cases, and about 35% of those cases are really significant or moderate changes that we expect will change treatment, change diagnosis, and change the long-term outcome. And of course, we do have customers that pay us, so we have to think about the financial return. We tell all of our customers that the main goal of our program is not the financial return, but because there's so much inefficiency in these complex cases, we've been finding consistently over the last 2 years, we have about a 3-to-1 return. So that's another standard that we report out to the employers.
Thank you. You're clearly demonstrating the tremendous impact that AccessHope is producing, and it really hits home, especially the personal stories with the patients. What else are you proud of about what AccessHope has established so far?
Well, I'm proud of the team that we built in AccessHope. We're becoming a mature company, but we've moved very fast over the last 2.5 years. We never expected to have this volume, and we're still performing with a net promoter score over 80. I think it's about 85, give or take, and world class is 70. So we've really delivered. But I think beyond that, really proud of the fact that we're standing up and addressing the healthcare disparities in cancer outcomes. Whether someone is in the boardroom or in the mailroom, they deserve to have the same access to the most leading edge scientific data and insights. And that's what we're able to do. And at a time where the pandemic has made crystal clear the disparities in outcomes by race, by social class, by access to healthcare, we find ourselves to be the great equalizer of democratizing this information to everybody. So that's really important to everyone who works at AccessHope and to the mission of City of Hope. I think relevant to what's going on in LA MedTech this week, I would say there's two other things that are really important. Number one, we know that the national uptake in clinical research is about 4% for people enrolling in cancer trials. And we know part of the reason is that the busy community oncologist doesn't have the time to identify those trials. So we're really pleased by the fact that we're able to bring that information to the treating doctor, and we look to enroll more people in clinical trials. The second issue is, while we have all this great advancement in genomic medicine with companion diagnostics and targeted therapy, if doctors don't know about it or don't know the right way to use it, all the great discoveries that we're talking about during LA Med Week are going to sit in a shelf. So we look at ourselves as an accelerator to making sure that the research is advancing more quickly through enrollment, but also the drugs are being used. Because if you don't bring innovation to patient benefit, what's the use of the innovation?
Exactly. As we finish up our discussion, can you tell me what is the strategy for the future for AccessHope?
Oh, I'd be happy to, but you got to keep it secret and not let anyone know. But we want to expand our network. We've already expanded our network of clinical experts beyond just City of Hope, and we now include medical oncologists and cancer doctors from the Robert H. Lurie Comprehensive Cancer Center of Northwestern University. And going back to your earlier question, I'm really proud of the way the physicians have supported this program. This is a new way of delivering care when you're asking doctors to deliver remote care for patients they may never see. But they've really embraced that, and I'm really quite proud of that. But continuing on with this question, we want to grow to have a larger employer base. We already have our first large regional health plan as a customer, and we're excited about that. Over time, we'll develop more consumer-facing products. We talked about our cancer support line, but we think there's really an opportunity to go deeper in the issues that really matter. For example, depression and cancer, or pain management. And then, on a more aspirational level, our goal is to make this sort of program the norm in cancer care. I mean, if we were all step back from what we do today, and whether you're an employer or a comprehensive cancer center or a community doctor or a health plan, if we were to start over, we would never take one of the scariest diagnoses, the scariest conditions, life-threatening, very emotional, at a time of rapid change, and ask them to go to a single doctor and put their lives in the hands of a doctor who may be an excellent physician, but can't possibly keep up with all the latest information. And what we want to do is make our program the norm, where whenever there's a complicated case, that the treating physician doesn't lose control of the patient, but has an easy way to access that information through a discussion with a subspecialist that can help support them deliver more holistic, more cutting edge, and ultimately more successful care to their patients. So that's the goal. If you look at the end game for AccessHope, that's what we want to accomplish over the next 3 to 5 years.
Yes, I can see that AccessHope and you're well on your way. And thank you so much for your time today and for this very insightful introduction and discussion on AccessHope.
Thank you, Ildi. My pleasure.